Welcome to You're in Good Hands, the podcast where we dive into everything urology. Leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice. All right, everybody, welcome back for another deep dive. Today, we're tackling something a little delicate, a little hush-hush, but something that affects a lot of people, and that's erectile dysfunction. It's not exactly dinner table conversation, but it's super important and can actually tell us a lot about overall health and well-being.
Exactly.
We're going deep on this one thanks to some awesome insights from the experts over at Advanced Urology in Georgia. These folks really know their stuff, so we're excited to share what we've learned.
Definitely.
Get ready to have some of your assumptions challenged because ED is a whole lot more than just a bedroom problem, as some might think.
Absolutely. You hit the nail on the head there. It's often a sign of something else going on beneath the surface.
Okay, so let's talk about those signs. What kind of underlying health issues are we talking about that might be linked to ED?
Well, first, think about those blood vessels. It's all about good circulation. If things are clogged up with high blood pressure or diabetes or high cholesterol, it's going to be tough to, rise to the occasion.
So it's like our bodies have a plumbing system, and sometimes those pipes get a little rusty.
Exactly. And just like any good plumbing system, you got to keep those pipes clean and clear.
Makes sense. So maintaining those healthy habits like keeping our blood pressure in check and watching our diet, that all plays a role?
Big time. But here's the thing. It's not just about the plumbing. There's also the wiring to consider.
The wiring?
Yeah. Neurological conditions, things like multiple sclerosis or Parkinson's disease, they can interfere with the nerve signals needed for an erection.
Wow. So it's like the equipment is there, but the communication lines are down.
Exactly. And of course, we can't forget about hormones. Low testosterone can definitely be a factor too. And then there's the whole mental and emotional side of things. Stress, anxiety, depression, they can all put a damper on things.
So it's like that old saying, the head bone's connected to well, you get the idea. It's all interconnected.
It really is. It's mind, body, and everything in between.
So it sounds like getting to the root of ED involves more than just addressing the symptom itself. It's about looking at the whole system.
Exactly. It's like detective work. You got to look for clues.
All right, Sherlock, walk us through it. If someone's concerned about ED, what's the first step in this investigation?
Well, the first step is always a good old-fashioned chat with the doctor. No need to be embarrassed about it. They'll start by getting a thorough medical history and doing a physical exam, just to kind of get a baseline understanding of your overall health.
So laying out all the pieces of the puzzle before we try to solve it.
Precisely. And then they might order some blood tests to check for things like diabetes, cholesterol levels, hormone levels, all that good stuff.
Sounds familiar, all the things our moms used to nag us about.
Yep, turns out mom was right. Those healthy habits really do matter. And then there's another test they might use called nocturnal penile tunescence.
Nocturnal penile, what? Now that's a mouthful.
It's not as complicated as it sounds. Basically, it measures erections that happen naturally during sleep. It helps distinguish between physical causes of ED and psychological ones.
So if you're getting erections while you're snoozing, it means the plumbing's working okay.
Right, which suggests the issue might be more in the mind.
Wow, that's fascinating. So it's like a secret mission while you sleep. I can just imagine someone trying to explain that one to their partner.
Yeah, it definitely has an interesting name. But hey, it can be a really helpful tool in figuring out the best way to treat ED. And speaking of treatment, there's a lot more to it than just medication. Lifestyle changes can make a huge difference.
Okay, let's talk about those lifestyle changes. What are we talking about here? Is it the usual suspects like eating healthy and exercising? Or are there some more surprising tips?
Well, those are definitely important, but we can get even more specific. Think about like the Mediterranean diet, lots of fruits and veggies and whole grains and healthy fats, that kind of thing.
Yeah, the good stuff.
Exactly. And exercise is key too. It's like a natural roto-rooter for your blood vessels, gets that blood pumping and keeps those pipes clean.
So we're talking about a full body tune-up, not just for the sake of, that, but for overall health?
Right, exactly. It all works together. And then, of course, there are the things we know we should avoid, like smoking and excessive drinking.
Yeah, those are the tough ones. But how much of an impact do those really have on ED? I mean, we all know they're not good for us, but...
More than you might think, smoking in particular is really bad for your blood vessels. It damages them and restricts blood flow. Basically, it's working against everything we're trying to do here.
So that's a big no-no. And what about alcohol?
Well, a little bit here and there is probably fine, but overdoing it can actually interfere with those nerve signals we were talking about earlier, the ones that tell your body it's go time.
Interesting. So moderation is key. It sounds like taking care of our overall health is really the foundation for a healthy sex life, too.
Absolutely. You can't separate the two.
Makes sense. But let's be real, sometimes lifestyle changes alone aren't enough. I know a lot of people are probably wondering about medication specifically. Those little blue pills we've all heard of?
Ah, yes, the famous PDE5 inhibitors, Viagra, CialisHow, those are the big ones.
Right. So how do those work exactly?
Well, they work by increasing the effects of nitric oxide, which is a molecule that helps relax the blood vessels in the penis. And that leads to, you guessed it, increased blood flow.
Okay, so they're not like magically creating an erection. They're just helping the body's natural processes along.
Exactly. They're more like a helping hand than a magic wand.
That's a good way to put it. So they can be effective for a lot of men, but they don't work for everyone, right? And there could be side effects.
Right. They're not a miracle cure. Some common side effects are things like headaches and flushing, and for some men, they just don't work as well as others.
Got it. So it's definitely not a one-size-fits-all solution. What about for those who don't find relief with lifestyle changes or medications like those PDE5 inhibitors? What other options are out there?
Well, there's a pretty interesting treatment called shockwave therapy. It might sound a little intense, but it's actually non-invasive and relatively painless.
Shockwave therapy. Okay, now I'm picturing something out of Star Wars. What exactly is happening there?
It's a lot less traumatic than it sounds. Basically, it uses low-intensity sound waves to stimulate the growth of new blood vessels in the penis, a process called neovascularization.
So it's kind of like jump-starting the body's natural healing process.
Exactly. It's encouraging the body to create its own internal repair crew.
That's pretty cool. So it's not just a temporary fix. It's potentially addressing the root cause of poor blood flow. But what about those who need a more immediate solution? You mentioned injection therapy earlier, but I have to admit the thought of needles down there makes me a little squeamish.
I understand needles aren't for everyone, but for some men, injection therapy can be a very effective option. Basically, it involves increasing medication directly into the penis to help achieve an erection.
Okay, so it's a more direct approach. What kind of medications are we talking about here?
They're called vasodilators, and they work by relaxing the muscles in the penis and widening the blood vessels, which allows for increased blood flow. The most common ones are alprostadil paparin and a combination known as Trimix.
So there are a few different options depending on the individual. How do you decide which medication is best?
Well, your doctor will take into account your medical history, any other medications you're taking, and of course, your personal preferences. They'll also make sure you're comfortable with the whole process, which includes learning how to do the injections yourself at home.
Wait, you do the injections yourself? That's not what I was picturing.
It might sound daunting, but it's actually pretty straightforward. It's similar to how people with diabetes learn to administer insulin. Your doctor will walk you through it step by step and make sure you feel confident and comfortable.
Okay, so you're not just left to figure it out on your own. That's good to know. What about side effects? Are there any risks involved?
The most common side effect is mild pain or bruising at the injection site. There's also a small risk of priapism, which is a prolonged erection lasting more than 4 hours. It's rare, but it's important to be aware of it and seek medical attention if it happens.
Got it. So injection therapy is definitely a viable option for some, but it's important to talk to your doctor and weigh the risks and benefits. Speaking of weighing options, I'm curious, what about those who haven't had success with any of these treatments? Are there any other options for them?
There are, yeah, for those cases where other treatments haven't been successful, or for men with severe ED, there's the option of a penile implant.
Okay, so now we're getting into territory that sounds a little more well-intense.
I can see why you might think that, but honestly, the technology has advanced so much these days.
So what exactly are we talking about here?
These implants are actually inflatable devices, so they allow for, natural feeling erections.
Wait, hold on. So it's not just some static thing you can actually control when you have an erection.
Exactly. It does involve a surgical procedure to place the device, but for a lot of men, it can be really life-changing, and the satisfaction rates are surprisingly high.
Wow, that's amazing. So we've covered a lot of ground here, everything from lifestyle changes to pills to shockwaves injections and now implants. It seems like there's truly an option out there for everyone, no matter what their situation is.
Absolutely, and that's what's so important to remember. There's no need to suffer in silence. There are solutions, and the first step is just talking to your doctor.
Right, and they can help you figure out which option is best for you. Speaking of finding the right solution, I want to give another shout out to Advanced Urology in Georgia. They seem to be real leaders in this field.
Oh yeah, they're fantastic. They offer all the treatments we've talked about, and they have a really experienced team of urologists who are dedicated to helping men, reclaim their confidence and well-being. They understand that it's not just about the physical symptoms, it's about the emotional and relational aspects too.
Right, it affects every area of your life. So it's great that they take such a holistic approach. They're not just treating the problem, they're treating the whole person.
Exactly. And for anyone listening who's not in Georgia, there are plenty of qualified urologists and men's health specialists all over the country.
Yeah, so do your research, find someone in your area who specializes in ED, and don't be afraid to reach out for help.
That's such an important message.
I think that's the biggest takeaway from all of this. You are not alone. ED is incredibly common, and there's no shame in seeking help. In fact, taking that first step is a sign of strength and self-care.
Couldn't agree more. With the right information, support, and medical guidance, you can overcome the challenges of ED and live a happy and fulfilling life.
Well said. So to all our listeners out there, if you're struggling, remember those words. You are not alone. Reach out, talk to someone, explore your options, and take control of your health.
And never underestimate the power of knowledge and open communication.
That's a great point. Well, that about wraps up our deep dive into erectile dysfunction. We hope you found it informative and maybe even a little bit empowering. Remember, you're not alone in this, and there's help available.
Until next time.
See you then. If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.